Yeah. So now we have Commander Navneet Bali with us, who is a director, Northern Region for Narayana Health. I'll just give a quick introduction of his. Commander Bali has completed his master's in finance from NIFM and BSc from JNU. He's also done his financial cum administrative management course for the Navy and a special course on strategic financial management, inventory control, and working capital management from Edinburgh Business School, Scotland. Prior to joining NH, he was associated with IOSPL Cancer Therapy Centers as Group Chief Operating Officer and Head of Business. He also worked with Rockland Hospitals as Unit Director before venturing into the healthcare industry. He served in the Indian Navy for almost 30 years, and in his current role at NH, he is responsible for overall strategic planning, operations management, service excellence, and business development of the Northern Region. His most recent appointments also include Co-Chairman National Health Council at ASSOCHAM, Member Health Subcommittee (ICAI), Mentor for Atal Innovation Mission (Niti Aayog), Member Delhi NCR Chapter and National Convener Media (AHPI), and Board Member of MedML. Commander Bali would be speaking on can ICT make a difference in providing healthcare? Its information and communication technology make a difference in providing healthcare. So over to you, sir.
Thank you very much, and I'm thankful to you, Mahinder and Meditec Clinika for inviting me today. So the topic I'm supposed to be speaking today is can ICT make a difference in providing healthcare? And the answer to that will be an overwhelming yes. I will take you back a few years from now, and all of you who are an avid Apple fan, let me take you back to April 2015. April 2015 is when the Apple Series 1 watch was launched by Tim Cook. And I remember buying that watch that time, and many of us did that. And the Apple Watch entirely focused that time on, receiving calls, receiving messages, scheduling your appointments and things like that. And, it was a sort of start point of, the variables that will come in the future. Cut to 2018, and Apple introduced the first heart rhythm, app inside its watch. And many of you who watched the latest Apple 6 watch launch and Tim Cook's speech again, you would have noticed that the entire speech, around 80% of it revolved around healthcare, whether it was SpO2 monitoring or it was, ECG or fitness and things like that. And so goes for many other, variables across the world today which are being launched. So never, ever, ever has the world focused so much on healthcare than it is today. And COVID has just been a curtain which we have now removed, and we see that the healthcare delivery can be made in a very, very different manner. About a month back, I also attended a discussion again online. And I was surprised to hear a word called Deminar. I had heard webinar till that time. I didn't know what Deminar was. And lo and behold, there was a company which, showed me a robotic arm which is used to help the surgeons and doctors in the OT. And the complete demo was given online. And so, they called it a Deminar. And, so what I'm trying to say is that from what we were seeing many, many years back and now what we are seeing today, there's been a paradigm shift into, looking at the opportunities which already existed. It is not that today all these technologies, one fine day when COVID came and we are seeing that these technologies suddenly have come out. It's not that. It's that all these technologies existed, but I think COVID-19 sort of pushed us towards, more and more towards closer to them. And that is what I call that it was an opportunity which was waiting to happen. And actually speaking, COVID-19 has pushed us towards having, closer look at it. Going now to a specifics of, how ICT can help healthcare. If I divide, it into two specific parts, the clinical part and the non-clinical part. Many of you are aware of programs like IBM Watson, which they started talking about, a decision-making matrix for, treating cancer patients. And, they required a huge amount of data which was available. And then they would run some algorithms to come out with a specific treatment for cancer patients. And that was one of the few, AI, ML based platforms which started making inroads into how clinical, decisions can be also, helped using technologies like AI, ML. And I'm talking this about 5-6 years back, and I'm sure many of these companies had started looking at healthcare using ICT. What COVID essentially did was, as I said earlier also, that these all technologies were waiting across the curtain, and COVID just was a curtain which when we removed, we saw that it was right in front of us. And that's why we saw more and more of remote counseling, remote, OPD consultations, sharing your reports online, testing, which was again, the reports being sent online. And we saw this happening more and more, even going to a stage where, since COVID was a very, very infectious disease, and we found many of the hospitals and institutions woefully short of manpower. I mean, many of these patients were being monitored remotely by a group of doctors who were sitting somewhere else. And this started happening in last, 6-7 months. It came in the front. And not only that, we sort of, innovation has been in the blood of mankind, and whenever need comes, people rise up to innovate things, and we actually saw it happening in front of us. We never would have believed that we would be interacting with thousands of people across the globe on webinars, but we started doing it. And so was it for healthcare, and it went on to prove that humans will not be limited by restrictions and obstructions. They will always find ways and means of going beyond it. And somehow technology actually proved that it can be done. And we had started having more and more of these technology based innovations which actually started coming to the use, and we saw these happening all across us, and we are a witness of this transformation, which COVID somehow was a catalyst. Just to give you a few examples, Narayana Health, Dr. Shetty has been talking about, using digital to help the patients in a very, very big way. And about 5-6 years back, NH had started sort of, investing into technology. And what we see today is we have platforms like Adi, Atma, etc., which are again, AI ML based, and Atma is of course our HIS system, which are AI ML based platforms. Some of them are platforms which the doctors use to monitor the ICUs remotely. As we are aware that critical care units don't necessarily require that so many few doctors would enter that area. It's a zone which should be infection free. So we saw that many of these apps on your mobile phone could be used by doctors to remotely monitor patients which you actually do not require to go. So the infection control was much better. You could get all the data on your mobile, and hence this piece of the equipment that we use now almost every day became a repository of not only data but also of communicating with patients, also for analyzing data, for helping us build many, many decisions. We've also seen over a period of time more and more startups looking towards AI ML platforms. So as I said, there are two parts of this whole paradigm. One is the clinical part, in which artificial intelligence, machine learning, and many such robots. I talked about a seminar that I saw where a robotic arm was helping to a surgeon. It was slightly different than the robots where you're doing a surgery. This was again one more innovative method. And the non-medical part, that is the administrative part, again, in a very, very big way, we found that a lot of startups and a lot of companies, a lot of individuals started getting interested using algorithms, using artificial intelligence and machine learning to come out with solutions that administrators face day on day. A small example would be to a financial counseling given to a patient when he comes to the desk, and in the final bill which comes at the end of his period inside the hospital, there was a great variance which caused huge amount of dissatisfaction. Now there are platforms available which bring that gap, make the gap much, much more narrower. We have patients who did not know whether how much time the surgery will take, what will be the discharge period. Again, we saw that AI ML platforms brought some sense of a sanity into all this, the complete series of events which led into from the admission till discharge and made it much simpler for the patients. Uh, we are also seeing not only the private sector which has started innovating. We see huge amount of ideas coming across the globe now, and we are seeing that the government policies in India and abroad are moving towards that in a big way. You must have heard about this digital records. You must have heard about the digital numbers to be given to patients. You must have heard about a great amount of push towards electronic medical records. And as we talk about this big jargon, technology jargons like AI, ML, we understood that till the time you had a very solid foundation of an EMR, most of these words would fall flat, because you required a huge amount of data to crunch that data and then to come out with algorithms and solutions to that. But it's quite evident now that the arrow has been shot, and there is only one way forward, and that way forward is to develop a very robust EMR system, to develop a data repository which can be then crunched and solutions to be brought both the clinical and non-clinical side. It also makes it quite mandatory as the future looks for doctors and for healthcare workers to become technologically savvy, because until unless they are technologically savvy, they won't be able to use these platforms, and it might become quite mandatory in the future. It might have medical legal implications. And so somehow both the events which led up to from COVID till now, government policies making patient care much better, and also clinically maybe helping doctors to come out with much better clinical outcomes, became the talk of the day. And we have seen now, and it is no longer that we think of it as a futuristic implication. We see it happening right in our midst. That is the situation which exists now. Now let us talk slightly about the future, if I'm allowed to crystal gaze into the future. As soon as you move towards faster speeds, you move towards better data handling capacities in your networks like 5G, 6G, 7G, 8G. It's my sort of assumption, and sort of a as I said, if I'm a bit allowed to crystal gaze in the future, that you can have a situation where as the technology develops and the lag between the mechanical movement of arms and things like that is minimal, you might have situations where a surgeon sitting across many miles away, in another continent, might perform a surgery in some other continent. It can also happen that the whole hospitals, the way we look at it in the future, change, and we have hospitals which are, as I said, I wrote in my LinkedIn some days back that hospitals might be congregation of operation theaters along with their pre and post op areas, etc. And you might have a surgeon who's sitting in a lab or a comfort of his home, which is actually a technological studio, and then he performs surgeries sitting there across the world. Because you might have such specialized surgeons who don't have to then travel. They can sit at one point and perform surgeries across the globe. Along with this data transformation, along with the use of ICT, obviously will come many questions of data security. It will come, where the data of a patient, remains quite valuable, and it is, treated that way. And so I'm sure many more legal, rules and regulations will sort of follow as it happens. But it is, sort of my assumption that going forward, not only ICT will help healthcare, if I divide it into clinical and non-clinical, both of them, it will also help policymakers and governments to reduce the cost of healthcare. And also one big transformation which might happen is, rather than data being stored in the HISs of the hospital, the data will be now stored with the patient themselves. And also the data will have a cross transformation capability, in which even not only intra nations but inter nations. That means globally we will be able to transform data. We'll be able to read data in the same format across the globe, across the world. And so that means that we are already moving towards a global village. We are already moving towards technologies, intelligence, capabilities being used across the globe. ICT will anyway superimpose what we are thinking right now and make it happen in the future. So as I started in the beginning, can ICT make a difference in providing healthcare? The answer is an overwhelming yes. And as so be it that we had to go through this pandemic, which and to sort of see what is beyond the curtain. But I'm sure many of us were thinking in those lines when some years back that ICT will take on and make healthcare much so if healthcare can be made more safer, it can be more quicker, less painful, better outcomes, and less costlier. I think all these five it can be done, which I'm sure ICT has the capability of doing so. I think that would be greatly in the interest of the patients and the in general about the health of the population. I'm done with what I have to say. Thank you very much for listening in, and keep safe and keep following the precautions that we are doing. So that the battle against COVID continues. Thank you very much.
Thank you very much, sir. Thank you, Commander Bali, for this insightful speech on ICT. Can ICT make a difference in providing healthcare? You said overwhelming yes, because it's the era after COVID. In the post-COVID era, we are living in this ICT, ICT framework only, because this is also happening in a ICT manner. This conference is also happening in sitting inside the home, inside your office, no physical contact. So thank you very much for joining in. Thank you very much for giving us your valuable time, and we would connect in future also. So
Thank you.
thanks very much, sir.
Thank you so much.